That was on the seal, otherwise I would have done it.
Nice job. That was quick.
You don't have to tell me.
Did I miss anything in there?
Nope.
I was
There's
just
a cheat
thinking
field.
it's not on the
Great.
agenda.
Are we ready?
Yeah, better than before.
All right, I'll grab you guys now.
Good evening. This is a meeting of the North Andover Board of Health, Thursday, December 16th, 2021, 6:30 p.m. I'm Joe McCarthy, Board Chairman, and to my left is Michelle Davis. She is the clerk of the board. To her left is Daphne Alva LaFleur. To my right is Patrick Scanlon, and to his right is Max Tilson. Well, Patrick and Max doctors. Over here, I don't know if you can see, but over here, as members of the staff, the department head is Brian LaGrasse, and the health inspector is Stephen Casey. So at that, the meeting is open, and the first order is the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Approval of meeting minutes. Michelle?
I make a motion to approve the minutes from November 18th, 2021, which have been reviewed and edited and are ready for approval.
Is there a second?
I'll second it.
All in favor, say aye.
Aye.
Minutes are approved. New business, animal regulations. Is it Steve, or is it you, Brian, you want
I'll start.
to take it? Okay.
Before we get into the animal regulations, which I sent you guys just a draft copy earlier in the week, I'd like to introduce our new public health nurse, Carolyn Lamb. Not Carolyn. So, welcome.
Welcome.
Glad to have you on board. It's been a long, arduous search, but we finally found her. And she accepted the job and started a week and a half ago. So she's getting her feet wet.
Right into the thick of things.
All of our new stuff and getting her up to speed on everything that we do. So it'll be a long process, but she's doing great. So welcome to your first board meeting. And next time we'll have a nameplate and a sheet on your folder that has your name on it, so you know what it said. All right, so on the animal regulations, this is something we've talked about for a long time. I think we started this pre-COVID, and to make a long story short, we used to have animal regulations in the department 20, 25 years ago. But back then, it was a paper copy. The office has moved multiple times since then. Nobody can find them anywhere, so we got to start from scratch and redo animal regulations. We do have an animal permit that we issue to people in town that have chickens, goats, horses, cattle. Believe it or not, we actually do have these in town. So we've got to get something on the books to actually cover the criteria for having the animals, lot size, zoning, manure storage, things like that, stable requirements, distances and offsets to water supplies, private wells, lot lines, things like that, just to get some criteria for people to understand what they can and can't do. We get calls all the time. Somebody 2 weeks ago wanted to have goats on Waverly Road. I'm like, probably not. So if we have it in writing, we have something to enforce, criteria to give people so they can do it. So Laura, who is working with us temporarily for the foreseeable future, which is great, helping us with all of our workload, went online. A lot of towns do have these, and we got a sample regulation from another town, and from MHOA, which is our Health Officers Association, has templates and things that we can basically choose from and pick from. So we pulled this together. This is just the first draft, just getting something on the books and for you guys to have in front of you. So take a look at them at your leisure. Joe and I have already talked about a couple of minor edits here and there. As you see, there's an effective date in here that obviously will change depending on when you guys do your first public hearing, and then second public hearing and adopt it. So it basically goes through our authority, the purpose, definitions of all the vocabulary that would be used in this regulation, and then criteria for any special requirements. It does discuss the zoning bylaw. So at first it referenced the zoning bylaw, which dictates the number of chickens you can have in some zoning. We basically cut that out, put that in here to mirror it, so they don't contradict each other. Application requirements, permit, and then construction and construction changes for if anybody's gonna do a stable or a coop. Just some requirements that they should pretty much abide by. And this can change. You guys can take a look at it. We can discuss it. I can get other regulations from other towns, to give you guys more examples. If you guys want to pull some best practices from neighboring communities, that's always something that we usually do to make our life easier. So, and then enforcement and penalties, and then hearings and posting of legal notice. If someone wants to apply for a variance, there's a process. So that's all spelled out in a few pages, nothing too complicated, but we do want to get something on the books. Like I said, we started this, what, 2 years ago?
I think we're missing section 4.
Are you missing section 4? All right.
But it was in, did you send it through email? We have it through.
It might have been on the back page. All right.
Okay.
Yeah, by email, we do have section 4.
Okay,
Yeah.
perfect.
The
That's
email-
fine.
I just printed off what I had on my desk, so there might be a page missing.
That's okay. I was like, I'm missing what you're talking
All
about.
right, so yeah, I emailed it to you this week.
Okay.
Take a look at it.
Perfect.
I can re-email it to you guys tomorrow as well. I can incorporate some changes that Joe had talked about, just some verbiage, things like that. So I'll send you guys a new copy, and we can discuss it again at a future meeting. If you want to have it on for January, I can put it on that agenda. We can talk about it in more detail at that point.
Brian, would you like to hear back from all members of the board before our next meeting
Sure.
on any changes?
Yeah, give you guys some homework.
Great.
So does that mean we'd have to wait till the next meeting to even plan the public hearing? So are we like 3 or 4 months out?
And that's perfectly fine.
Is that
yeah,
okay for you?
yeah,
Okay,
Yeah. It's not a rush. It's been literally 2 years, so,
okay.
but at least we start the process now. I thought we'd have more capacity in the department, but as you guys know, things have made a turn, and we're extremely busy. But I will have it on the next agenda.
So this has nothing whatsoever to do with dog breeding and the number of animals you have inside your house whatsoever?
Nope. This
Okay.
is just
Okay,
agricultural,
okay,
chickens, no roosters,
right.
Pigs,
Okay.
horses,
Pigs.
sheep,
Yep,
Okay.
goats,
exactly.
pigeons too. I'm surprised at pigeons.
Pigeons. Yep, yep, I've run into in other areas, people that actually have homing pigeons, and they have coops for 100 pigeons.
Okay.
All right.
So we'll all get back to you before the next meeting,
Yeah, all right, great.
and then put all the comments together, and we can further discuss at that time.
So this, like, birds and fowl, maximum of 6, that means that they can't have more, unless they apply for a variance.
Correct, that's all, that's in the zoning bylaw, that's where we pulled that from.
Got it.
So we didn't contradict what they already allow. Other places do allow a lot more than that, depending on your acreage.
Okay.
Okay, we'll move on to the coronavirus
Okay,
update.
you wanna start this one? No. All right, basically, I gave you guys, some information. School committee is meeting tonight as well, so I've been meeting with them, as you guys know, on a regular basis. We meet once a week. We discuss what they're seeing in the schools in terms of students and their test and stay program. I don't know if you guys know that, but the test and stay programs, the rapid antigen test they do in school, those aren't reported anywhere except internally. So it doesn't get into Maven, it doesn't get into the state numbers. It's just one quick test that we can do on site to get a negative or positive test to let them either stay in school or have to go home and then actually isolate for 10 days. But those aren't reported anywhere. Those are just kept internally. They did send all the numbers to the state, to DESI this past week, from September through now. There has to be a way to get these numbers into Maven, which is what we track all of our stuff with. We manage all of our cases in Maven, and get those numbers into that and into our master spreadsheet. So I gave you guys some information that I gave to the school committee for their meeting tonight. In your packet is a spreadsheet that starts off basically, this is our weekly dashboard. This is from last Thursday. I started updating it tonight because the numbers are published at 5. I draw from those numbers, create our dashboard, as well as our local spreadsheet and our local Maven numbers. So I kind of put it all together. The first page of the spreadsheet goes through, I don't know if you guys have seen this yet. This has been on our website for a while. Sarah Brush sends it out via social media every week. I call it Groundhog Friday, because every Friday I get her the numbers and she gets them out. On page 2, this is part of that dashboard. And these are our weekly numbers going back to July. And as you can see, the progression over the course of the summer and the fall, there's a little dip at the beginning of October, and it comes back up. The numbers for 12/16 are actually higher than that. A few more cases have come in after I printed this out at 4 o'clock, so that's even higher. It seems to be just going up every week. Next page is the hospitalizations. We've been tracking this for a long time. This is what we've always talked about in terms of surge capacity and overall healthcare infrastructure. And as you guys know this very well, as you can see, the last number we have is up around 1,400. It was 1,200 last week. Granted, in the height of the pandemic, it was 4,000, which was astronomical and really taxed the healthcare system. We're only at 1,400, but it's still a lot, and it's still going up, which is obviously concerning to everybody.
What was, at the height of the pandemic, what was the ICU intubated?
I don't have that information. It was a lot, though. It was way up there, and there was at the point where they were running out of ICU beds and running out of ventilators, and there was on that brink of physicians having to choose who they treat, which is something you don't want to have to run into. On the next page, it says North Andover Health Department up top. These are, I just tallied some numbers for the school department for their information so they can make the decisions on their mask policies that they're discussing now. I extrapolated what we've had so far for this month, and we're seeing about 20 plus cases per day. At the end of December, we'll have around over 570 cases for the month of December. So you can see it goes up, and I went back to June for this one. We had a couple in June too, but it just keeps going up, and it's definitely a concern. I did also give them information on the Omicron variant. On our DPH web call on Tuesday, Dr. Brown discussed this a little bit more, which is good because the data is starting to come in. I don't know, you guys may have heard some things over the past week. What the state had talked about with us on Tuesday was, obviously they're still gathering data. And this is a concern, it's all over the news. People are a little freaked out over it because the Delta's come through with a huge surge over the past year. This started in South Africa about a month ago. So that was where they first genotyped it and determined it was a new variant and then started to track it. So they're still analyzing the transmissibility and the severity of it. Early reports do indicate that it's as transmissible, if not more than Delta, but it's not more severe, which there's a little asterisk with that. The people that have been getting it, that have been traveling, are younger, and younger populations are affected less, even by the Omicron variant, which is good. So the only thing that they can hang their hat on right now is in South Africa, the hospitalizations did not increase. They stayed and remained steady from the Delta variant to the Omicron variant. And that's been over the course of the last month. I think they first found it on November 11th. So that's at least positive.
I actually saw that it looks like the Omicron in South Africa has already hit its peak. And it's actually on its way down
Yes.
already.
Yep. So that's positive too. But they're concerned because it was affecting the younger populations, and they only have a 25% vaccination rate there. So that's also kind of skewing the data. Obviously, the younger people are out and about more to the younger populations, but the hospitalizations remain steady, and it didn't spread to the older populations and start seeing a high mortality rate. There's been 16 cases in Mass, and only one was hospitalized briefly and then released. Antivirals do seem to be effective against it, and the vaccines that we do have obviously are effective, especially if you have a booster. So there was discussions about J&J not being as effective against the Omicron, but I don't know if they're backtracking on that, but they're still looking to get more data before they make anything official. They did obviously recommend vaccinations and boosters. On the next page, I talk about the vaccine. This is something you guys know, but I wanted the school committee to discuss it tonight and get it out to the people that watch their meetings and get it into their minutes. But I basically wanted to promote vaccinations. One of the things we're seeing now is that ages 5 to 11 are obviously allowed to get vaccinated now. I want them to reiterate that. We do have a clinic scheduled for January 6th at the high school for ages 5 to 11. We're going to be getting a link to that out for the signups probably Monday. We're finalizing everything with the school department now. But I wanted them to go through each of these bullet points and obviously encourage people to get vaccinated. And then one of the things I wanted them to really talk about, and I hope they do, was they need to remember that people that are fully vaccinated don't need to quarantine if they're a close contact. We have had high numbers of sports contacts, as well as birthday parties, ninja gym, dance class, and you name it. You got a group of kids, they carpool together, they have a birthday party, they go out, they're on the same soccer team, and then next thing you know, you have 8 kids all quarantined at home, and they can't go to school and be in the test and stay program. So if they can get vaccinated, they can at least help get past that and keep kids in school. I think that's one of the main things we've been trying to do forever.
Is that policy going to be carried down to the elementary school level and the early education child center too, as now we're going to be doing the 5 to 11?
Yes. Yep, so if you have a 5-year-old that is fully vaccinated and they're on little Johnny's, basketball team, and there's a positive player on the team, and they practice for 2 hours the other night, or an hour Tuesday night and an hour Wednesday night, they would have to quarantine. And that's a problem. A lot of parents don't like to hear that. We've been yelled at a few times, but it is what it is. We just give them the information, let them know what they have to do. Schools are on board. We talk to the schools every day. We share information and we share spreadsheets. So we know who's doing what and who is in isolation and who's in quarantine.
It would not surprise me if the CDC pivoted to say only fully vaccinated includes boosters only. And so if you're 9 months out of your vaccine and not boosted, they may change that recommendation. We'll see. I mean, I think it's going to have to be a moving target for you guys.
Yes. I hope there's more clarification on that soon, because there is discussions about it. We've heard in our circles. Just to let you guys know, I ran some numbers earlier today. I calculated out that 40% of our cases are vaccinated. So people that got their second dose last February have waning immunity. It's pretty clear. I'm not on the DPH to make this decision, but it seems to me when I look at the numbers and see who has what vaccine, it's all 3, and it's consistent. They're all 3 there, and people that are fully vaccinated, even 18-year-olds, even people in high school that probably just got it 4 months ago, are popping up positive. Granted, they have very mild symptoms, if any, which is really good, but I calculated out 40%. And it ranged from, depending on the day, from 25% to 50%. But it is based on around 40.
It's going to be interesting because I was reading an article today that at what point are we going to be shifting these numbers as dealing with a pandemic to more now dealing with an endemic? Like, at what point are we really going to need to particularly care about those numbers of people just testing positive, like you can get the flu, and they have symptoms of a common cold?
Yep.
At what point are we going to be shifting that to more like critical illness or hospitalization as really the things that we're just counting on and looking at now?
I think that's coming sooner rather than later. I think there's And it's hard to turn a cruise ship, and we've been going in one direction for so long.
Yep.
It's gonna take some time to turn that mentality. My colleagues have been talking about it for a while now, because we know it's endemic. It's been 2 years. It's not going away, it's still here. Vaccines do help, therapeutics do help, antivirals help, which is all great news. But we still have to do what we're doing for the time being. The state has shut down the contact tracing collaborative, which makes our lives a lot harder because we have to reach out to all of the cases. They did, however, basically switch and transition from calling all the close contacts to saying just make the first phone call to the positive, let them call their own close contacts. So they're transitioning away from having to make 25 phone calls per positive case. At 37 cases the other day, there's no way we can keep up with that. We do have per diem nurses helping out. Carolyn's still here. Melissa Benet is still here. Judy Sullivan's still here. Carolyn's now on board, thank God. And we also have Deb Rillahan helping out a little bit as well. So we've got a good team of people working on it, but there's a lot. And we've basically determined that to not duplicate resources, we are prioritizing certain groups. Early education, K through 12, and then higher education in any type of cluster. We're working with Merrimack College and Brooks School together. They're also doing their own contact tracing on their campuses, which is great. The school nurses are helping out tremendously with the school-age kids. So if they get a call, they let us know. If we get a maven report, we let them know what school, the child, contacts, then they can do their own school. So all the school nurses are taking care of their schools, which takes a huge burden off of us, and we're doing everybody else. So we're trying to piece it together as best we can. It's kind of like a trial and error at this point. Contact Tracing Collaborative just shut down on November 30th. So December 1st, we started doing all of our own. Learning curve. But it is what it is. The transition will happen eventually from pandemic to endemic. I don't know when that's going to happen.
There's an article in today's Boston Globe on the Omicron variant of the virus. And what it said, amongst other things, is that this new variant may be up to 70 times more contagious than the Delta. Now, look, it's preliminary. We don't know for sure. But if that number's even close to being real, it says to me that because it is so contagious, that this may hasten COVID-19 to become endemic sooner than what we had thought otherwise.
Okay.
Interesting.
I mean, this is a variant of concern, and the WHO, CDC rank their variants. Variants being monitored, which between Delta and Omicron, there was 8 variants nobody ever heard about that came through but died out. Viruses mutate very quickly. Their generation is what, like one host, from host to host, where our generation is 30 or 40 years. So they mutate very quickly, they change very rapidly, and the successful ones move on, the other ones go by the wayside. So there were 8 variants that did not ever make the news. You know, the Omicron was the next one that actually started to sustain itself, which is why we're hearing about it. But Omicron, there are variants being monitored, variants of concern, variants of high concern, and variants of serious consequence. So we're only at variant of concern. So we're step 2 out of DEFCON 4. So it's being monitored and it's concerned, but it's not to that next step yet, which is good. And I think that's all that I really have about the COVID update. I'm trying to think what else I forgot. I'm sure there's something.
Several days ago, when we were talking, commented on these kits, these test kits, and I did go to CVS, they are available there. Want to talk a little bit about that?
Yes. So the state actually gave out 2 million kits this week to, I want to say, 60 communities, somewhere in that area. So people can test before they go to a holiday gathering. Obviously, over the past 2 years, we've seen peaks after every holiday, even 4th of July, which you would think it's outdoor barbecues, you're gonna be fine, but still transmission happens and occurs at these gatherings. So we know there's gonna be another holiday spike after Christmas and New Year's. They try to get these out right away so people can test before they go to a family gathering. Indoor transmission is still the bread and butter of this virus. Outdoor transmission is minimal, but as you know, indoor transmission, close contact gatherings, Christmas, Christmas Eve, Thanksgiving are all huge with transmission. So try to get the kits out for everybody to at least have them on hand. If you can buy them at CVS or Walgreens, we recommend that you do that. Knowing before you go to see your parents or grandparents or cousins and anybody who has a highly susceptible population, you want to know before you go. So if the tests aren't expensive, they're very accurate. We highly recommend that if anybody's going to a holiday gathering to try to get their hands on one to protect their loved ones and not, because you may not have anything. You may have a sniffle and have no idea that you have it, and then you give it to somebody else and they completely have a different reaction.
I think that gets back to the issue that we were talking about before. When you have these test kits, you're going to get your own information about your positivity, and you're not necessarily going to go get something which is monitored by the state. So to your point, the numbers that the state is kicking out are going to be falsely low because people are going to test, they're going to be positive, and they're going to say, I got it, and they're not going to go get tested. So the numbers that the state produces are going to be low, lower than they actually are.
Right.
How long does it take to get these test results back?
15 minutes.
15 minutes.
Yep.
So that'd be
Very easy.
positive, negative, and you're the one that knows about it and no one else if
That's
you
right.
do
You
not
don't
want
have
to
to tell
share.
anybody. You don't have to do anything. You hope you hope the people will do the right thing and tell the people that they need to tell, but there's no guarantee that they will. They may not.
Yep. If they test positive themselves, stay home for 10 days, isolate, and don't spread it to anybody else. I think that's our recommendation. I didn't talk about our vaccination rates, but North Andover is doing really well. Massachusetts is doing really well. We're at 82% partially vaccinated and 73% fully vaccinated in town. That's per town census, the numbers that we have through MIS. So we know we have a really good vaccination rate. Mass in general is doing really well. I think that's why the state doesn't want to implement any broad sweeping mandates or restrictions at this point, because the vaccination rate is so well. They want to keep that going and see where it goes from here. But they are opening up Fenway. We're doing clinics here. Greater Lawrence Family Health Center is doing clinics all around the area. The hard part of it right now is getting the staff. The vaccinators are very hard to come by, and they are flat out every day, all day. So I try to work with them and get them as often as I can. They gave me 2 dates for the month of January. We're going to try to reach out to them again, see if they have any other openings, but they are flat out. And there's some companies that we can use too. Some are better than others. There's a company that we use called Pelmed Pharmacy last year. I've heard some really horrific stories about how they're running things now, unfortunately. Some of my colleagues tried to use them, and it did not go well for them. So it made them look really bad.
So Brian, you're saying that the limiting factor is human. It's not product.
A little bit of both, but it's more human.
That seems fixable.
I mean, they're going to open up 150 slots for us for the next clinic. I want more,
Yeah.
but they don't have the staff to do it. They need the staff. And unfortunately, it's a private healthcare. Not private, but it's quasi-private. They can't have anybody coming off the street and start vaccinating. Even school
Right.
nurses aren't allowed to do it under their standing orders, so we're at a standstill at this point. We're gonna get as many people as we can in, and we don't have people to do it.
Are all the CVS's and Stop and Shops, are they doing kids?
Yes. If you can find an appointment.
I mean, I guess the problem with those is there's only one person in most of those
Yeah,
places.
so it's
you know,
like
and
just
they-
staggered.
And they have to have people isolate, have people sit there for half an hour afterwards, or
Yeah.
20 minutes, or whatever, so.
Person that I connected you via text message, the pharmacist, he's really good, and he
Okay.
has his own staff. I can reconnect you, but he will come to you and fully staff as well.
Great.
That'd be awesome.
Well, and the pharmacies are doing the flu, so that same person is going flu,
Yeah.
COVID, flu,
Mhm.
COVID, flu, COVID.
Yeah, but yeah, you can reconnect me with him.
Yeah,
that'd be great.
yeah. I've used him
Thank
for a
you.
couple of clinics at housings, and they're really good and professional.
Okay, awesome, thank you.
No problem.
I also read that in Massachusetts, the vaccination rate is within the top 3 in the nation.
Yep.
I think Vermont is number 1, so that's impressive. And that's 74%, that's of all people,
All
correct? me if
people
I'm-
in town.
Even infants.
Yes, the entire total population in town, which includes the age groups that can't be done yet,
Mhm.
is at, was it 73 or 74% is what I said?
73.
Yeah.
Yeah,
Did the high school get to 80% yet?
yes, high school's at 80%.
Great.
However, school department policy right now is still that they have to keep their masks on. DESI's policy is you have to apply for a waiver from their masking rule, which they're discussing tonight, which is why I gave them all this information, and they can discuss it themselves. They wanted me to be there, but obviously I had prior obligation, so I came with you.
What would you have recommended?
Hold on through the holidays. And we know there's gonna be a post-holiday spike. There's about 47 or 53 high school students right now that are positive. So that's the highest number we've seen. So for now, hold off through the holidays. Let's see what the state does with their DESI guidance, and let's see where the numbers go a couple weeks after New Year's,
When did they put their new mask mandate through?
January 15th.
I would say, like, at the end of January.
They're gonna extend it.
Yeah, they're definitely extended.
Okay.
Because we haven't even seen Omicron here yet.
No.
So the infections that you're seeing now are still Delta.
Delta's
So they
still the
haven't even
number
They
one.
haven't even gotten to the, I
Yep.
mean, if you think about the way these viruses die out, is you get something like Omicron, which is super infectious but not very virulent.
Mhm.
And everybody gets it, then they don't get sick, nobody dies, and this virus has no one else to infect. And that they can just, if the virus would mutate that way for one generation, it'd be over.
Mhm.
I had also read earlier this week that with this Omicron variant, there's only one known fatality in the world. And I did a double take on that. and I
I'm
said,
not,
"In
I'm
the
not
world."
sure I would buy
So,
that data.
well, obviously, I mean, there are other fatalities that haven't been noted yet.
Right.
But only one has been. And in Massachusetts, I don't think there's more than a couple dozen people that have the Omicron variant of this virus, correct me if I'm mistaken.
There was only a few handful, about 16.
But you also have to remember that all, like, routine labs are not testing
Yeah.
for the variant.
No, actually Mass is doing random sampling, but they're doing 30% of their samples are being tested and sequenced. So that's a really high number, which is good, because they're looking for it. But yeah, so that's it. That's all I got. How about you guys? What are you guys seeing in your practice and in hospitals?
Well, so I don't want to be a big gloom and doom guy. But the numbers that you quoted about how the hospitals look so good because there's fewer hospitalizations and there are
Yeah.
fewer ICU people, that's great, except for the fact that all those patients that were in the hospital were in empty hospitals. So they converted all those hospitals into COVID hospitals. Almost everybody in the hospital had COVID.
Mhm.
There were very few people in the hospital that didn't. Everyone stayed home and they got sick with a chronic illness and then showed up later, like now.
Okay.
So now the hospitals are packed. There's no
Okay.
beds.
Oh, yeah.
There's no room. The hospitals are creating new ICUs out of floors that aren't supposed to be ICUs, and the hospitals have nowhere to put people. The last hospital I was in, there were 36 people in the ER waiting for a bed in the hospital where none existed. And it's not full of COVID patients. It's full of patients with other chronic illnesses that have just sort of spilled over
Okay.
into this. A lot of the hospitals now they have a mandate to cancel elective procedures, like we did before.
Yep.
And they're canceling not because we don't have masks. We've got a ton of masks and we got a ton of stuff, but we just don't have places. So if someone gets if someone has, if I do a procedure on someone and they end up needing a hospitalization because of the procedure that I did, I have worsened the problem. So elective procedures are canceled. And are now canceled until the middle of January for sure, and my guess is longer than that.
Elective procedures such as, for example, as a gastroenterologist, colonoscopy, is that considered?
For example, a colonoscopy, yeah. So
Wow.
there are some hospitals that are still allowing them.
Wow.
Sometimes, the other thing is that staff is burnt. And so there's been a ton of attrition among the nursing staff. And so there are some beds that are open, but they just can't find staff to man them. So the hospital capacity is artificially shrunk because there are beds that can't be staffed because the nurses have burnt out. I mean, they've been at this for 2 years. And a lot of nurses, a lot of people in healthcare, and I don't want to sit on this for too long, but a lot of people in healthcare are extraordinarily frustrated by the fact that a lot of this was preventable and hasn't been prevented because you don't have universal vaccination. People have refused to get vaccinated, and so there are a lot of people who, granted, there are a lot of people who are vaccinated that get sick, but if you look at the people who are in the hospital that are vaccinated, it's about 30%.
Really?
So about 70% of the people in the hospital are unvaccinated.
I agree with Max that it's the smoldering storm of COVID, but now everybody else is just coming in sicker and sicker and sicker now. And now that full ICUs are not fully open because they can't fully open ICUs because of staffing, that they don't even have the nurses to take care of these, to fill these open beds.
So it's not just the vaccinators that we're trying to find, it's everything.
No, there's
Yep,
no one available.
it's just, and yes, burnt out is an understatement across the board.
I remember in March of 2020, which feels like a lifetime ago, we used to be able to go to Alabama and get nurses who had never seen COVID before, and they would come sweeping up here, and they were shocked at COVID. So we could fill our hospitals with traveling nurses who weren't yet familiar with COVID. Those areas of the country weren't yet affected. We were in the weeds here in 2020, and a bunch of nurses came up and they helped out. That talent pool is gone. They're all staying home, taking care of their people at home. It's not good.
I was going to segue and turn the meeting over to both of you, as I did last month, because to me, this is the highlight of our meeting, and probably will be the highlight for a period of time, to hear what the both of you, who are in the medical field, or both doctors, have to say about this. As mentioned during last meeting, when you listen to members of the media and politicians, at best, it's difficult to figure out what is really happening. Actually, I went to another source of information. I watched, after speaking with Steve and Brian, I watched South Park this past week because they're talking about the coronavirus, the information.
I have to watch that one.
But I'm saying, after I watched it, I'm saying to myself, this information is as good, if not even better, than what we're getting from the media and our politicians. But the best information from my perspective is what our two doctors have to say, and thank you very, very much. Again, looking at agendas and minutes of Board of Health meetings throughout the Commonwealth of Massachusetts, it's all the same. Coronavirus. Now, there's some things that we have to do, the more mundane things such as housing regulations, issues of concern with owners and tenants of houses, septic system upgrades, kids that have been sold tobacco and so on and so forth. We still have to do this. That can be a little bit boring, but this is really, really good from my perspective, because this is one of the few sources that I know of where we can get good information on the virus. You certainly can't get it from the politicians or the talking heads on TV, from my perspective. So thank you very much to both of you.
Can't wait to talk about mosquitoes again.
That'd be great.
Yeah.
No, on the,
Speaking of Lyme disease.
no, on this Omicron, how concerned should we be with it? Because again, it doesn't seem to be that
I don't know
deadly.
if we know yet, Joe. I don't know if we know yet. To be honest, I don't know if we know yet.
The hope is that it's higher transmissible, but less virulent, but it's still in its infancy.
I think the way I look at the hospitals is sort of the canary. So it's a metaphor for how much virus is going around in the area. So in the hospitals in the summer were relatively empty. We were doing a bunch of, and I was seeing people that I was trained to see, which was great. Then I knew there wasn't a ton of virus around in the community. In the last month, there are precaution things on the doors of many more rooms. And for me, if you think about the percentage of the people who end up in the hospital with coronavirus, being as small as it is, the number of people out in the community who must have coronavirus in order to get that number of people in the hospital has to be through the roof.
This is also going to have a rippling effect. You said that certain surgeries, elective surgeries, and colonoscopy is considered to be elective, have been postponed. That means that more people will die of colon cancer. I had colon cancer, and I didn't have the examination, didn't have the colonoscopy when I should have had it. I waited too long. I'm okay right now, but it's a horrible disease. And imagine there's going to be all kinds of problems that we can't even fathom right now. People not going to have certain tests in hospitals right now.
So Joe, if you need a new knee and you can't get your knee replaced or your hip replaced because the way to do that is long, it means you're inactive, which means you can't deal with your metabolic problems, so you may gain some weight, which may hurt your heart, which may hurt your liver, and then suddenly all those things start to cascade. So it's not just colonoscopies that prevent cancers, it's everything. If you can't get in to see him because he's busy in the ICU, you can't get your asthma fixed, suddenly you have bad asthma that's out of control. It's a whole bunch of things that just cascade down below.
Depression is getting worse. Over 100,000 people in the country have died of a drug overdose this last year, and things.
I think one other thing too is that we have sick patients in the hospital that certain hospitals can't do certain things, so we look to, from a community hospital, try to transfer a patient to a tertiary care center. Patients are dying because they can't get into a tertiary care center, and so that's because their ICUs and
Wow.
floors are jam-packed, and their ERs are jam-packed too.
See,
And it's
until-
not, COVID is there, and there's a surge, but it's now the rest of the population that did not seek medical care for close to 2 years, we're dealing with that too. And
Well, listening
burned
to
out
both of
staff.
you have only certainly heightened my concern, because I'm not getting this in other places that perhaps I should. Sometimes the urgency of this is noted by the politicians and the mediums. Sometimes it's not. It's a mess.
You get numb to it after a while, Joe, to be perfectly honest. I mean, you hear that the hospitals are full, it's like, you hear that 800,000 people have died, I mean, it's an unfathomable number.
Over
And-
5 million in the world, yeah.
But just in this country, 800,000 people have died in this country, and it's a number that I remember when people were shocked at 100,000. And the fact that we're gonna hit 1 million one day, and that's not that far away, you sort of get numb to it. So you hear the hospitals are full, and in the next breath you hear that, North Andover celebrating their 175th anniversary. It all sort of becomes noise. But it's there. I mean, it's as you say, it's endemic. It's going to come in peaks and valleys, and we're just going to have to deal with it and do whatever and as a group, sort of advocate for the things that work to prevent it from getting worse, like vaccinations and unfortunately wearing a mask if you have to sometimes. I mean, there's a lot of it out there. You just have to be willing to do that.
Anything else?
That's all I got. That's my little COVID update. But I'd love getting your perspectives on what you guys are seeing in your practice, because we don't hear about that. on the DPH calls, or from my colleagues that are doing public health, not medical. Any differences you see in each hospital? Are they night and day? Like, what's your perspective on that?
I mean, you can talk more about Lowell. I hear a little bit in detail on a daily basis about Lowell, but I don't know from it personally. I can talk about Lawrence and Holy Family.
Yeah.
Yeah, they're all in the same boat.
Mhm.
They're all, I mean, those two communities are really heavily hit by this thing.
Yeah.
So, you know, we have emergency meetings at both hospitals, and I haven't been to Holy Family. I assume it's the same thing there.
Yep.
You know, it's all hands on deck. It has been for the last. The people in the hospital, the administrators in the hospital have seen. I remember at the last meeting we talked about, you know, keep your eye on Europe because what's happening there is going to happen here.
Mhm.
And the people in the hospital administration knew that this was going to happen. They all saw it coming. But you just can't prepare. You can only prepare so much.
Yeah.
And then when it hits, you just sort of got to deal with it. I really hope that we can figure out a way to help you guys get, I mean, if the limiting factor for getting people boosted is people, then I would love to help you try to figure out how to get people here to get, because if it's not vaccine, it's the limiting factor, it's just someone willing to put a needle in an arm,
Yeah.
I think I can help you with that.
Dentists. Everyone always forgets the dentists. They get
Alright.
vaccinated. And they have small panels compared to everybody else.
Interesting.
Yeah.
What about EMTs?
What,
What about EMTs?
paramedics came back.
Yeah,
Paramedics.
I was just thinking of like, just the fire department, but I know the fire
The
department doesn't have
EMT,
any
the-
paramedics.
I don't think they, I mean, I know whatever level my husband is can.
Yeah.
And medical assistants vaccinate? They
can Yes, get they do. immunization.
But the care managers, aren't, they should be able to.
I know, like a lot of people, I mean, my team works in South Carolina, so they can't help us.
I-
But they're all
I bet you if you put
They're
out
vaccinating
a
on the
Yeah.
side, yeah.
email out to the
They ask a lot
town,
of my
the
team.
amount
The
of
introduction.
nurses available
Yeah.
or paramedics or
You've
medical
gotta get
assistants
away
available
from
in the
the
town.
nurses.
I guarantee you people would step in and sort of volunteer an hour to do it. Yeah.
Right.
I don't think that people,
Most of my
I will tell you, I think,
pharmacists
so it
are
was news to me
vaccinated.
that the limiting factor is people.
Okay.
And I think that if you put that out to the town and say, you know, we have vaccine, we just can't get into people's arms, can we as a town step up and get immunized?
Yeah.
I think it would be a rallying cry for the town. People would step up and do it, definitely.
All right. But it's everything. It's not just the vaccinators, it's the staffing, it's the resources to set the clinic up, to get it operating, get it running. Then there's the data entry and the MIS,
Yep.
everything involved. That's the hard part right now.
You have so many people here who would help you.
Yeah.
You have so many people.
Yeah.
School
kids
kids
I was gonna say, the high school kids, the high school kids have to do it.
All right.
And they're 80% vaccinated, right? So they can get in there and.
They are actually. The high school is doing really well with their vaccination rate. The other schools are lagging behind because they're obviously younger, but the numbers are starting to tick up, which is good in terms of vaccination percentages.
Brian, what if you lose your vaccination card? How do you get another card?
You can call, if you're a resident here, you can call us, we can print one out for you. We can go on, or if your primary care can do it, but CVS can probably do it for you as well. As long as anybody has access to the vaccination records, they can print you out, not a card, but a sheet.
Like a certificate.
Have
Yeah.
you heard if Mass is gonna start allowing, or are they
I
the electron?
heard.
I have one from Patient Gateway, so mine's now on my Apple
Oh, really?
wallet.
Oh, okay.
It automatically, I got a thing, I scanned a QR code on Patient Gateway and it's on my Apple wallet. But it said, I guess it's only acceptable if Massachusetts starts accepting Apple Wallet.
I have not heard that yet.
I heard the governor was, they're joining with like 20 other states to create some type of universal
Yeah.
card for your
Yeah,
phone.
it was like so easy. I mean, and mine didn't have my booster. And
Did you
so-
get it through, where did you get your
I got-
vaccines from? Was
one.
it like through your primary care?
No, but they knew it. They had it loaded into my,
Oh.
my medical record, even though
Okay.
I had got I got them at Lawrence and then my booster at CVS, and
Okay.
didn't matter. It was just connecting, as long as you could connect it to your record.
Okay.
but it's, I mean, that's a great thing, instead of having to carry around
Yeah.
your card.
Yeah, I took a
mean, it's
picture
like-
of mine, I just.
Yeah, but what, I mean, it's bright red, it's obvious that it's like official and I didn't make something up,
Yeah.
so, anyway,
That's pretty cool.
it is cool. It's, especially when you think about like the younger people that are starting to get, who are gonna carry a card around.
Yeah, or they'll
Yep.
lose it.
Yeah, like
I
I,
understand that fraud is a big problem too.
yeah, yeah, well, that,
Fraud?
yeah,
Yeah. People faking their cards.
right. I think that's the other thing, like, this, you can only get this through this, obviously the state is sending out the dates
Mhm.
and confirming it, so.
Oh, good.
You
Okay.
can't really miss it. I can show everyone later if you
Yeah.
want to see.
Okay.
Anything else?
Motion to adjourn?
That's about it.
Second?
Get that
There you go.
PSA out.
All those in favor say aye.
Aye.
Meeting's
Aye.
adjourned.
Thank you.